Hi everyone, welcome to today's presentation. Imagine you become a nurse practitioner today. What is your role? What is your scope of practice? What is the regulatory process? That is what we're going to talk about today. So welcome to the lecture. Psychiatric nurse practitioner became a recognized subspecialty in 1950. It influenced by the pioneers like John Mallow and Helgard. Psychiatric nurse practitioner role emerged due to the growth of advanced nurse practitioner and recognition of a holistic care. Psychiatric nurse practitioners have a foundational knowledge common to all nurse practitioners with specialty understanding in psychiatry. The nurse practitioner role, scope of practice, and regulatory process. Advanced nurse practitioners in psychiatry are educated at master or doctorate level and provide primary psychiatric care to individuals and family. The core components of nurse practitioner are scientific foundation, leadership, quality, practice inquiry, ethics, healthy delivery system, policy, technology and information literacy, and independent practice. Leadership competencies is a part of a nurse practitioner core competencies, focus on lifespan consideration, include family and population. Competencies can adapt to change in healthcare system, involves in a community population focused programs to evaluate and promote mental health. Advocate for complex client and family medical rights and issues. Collaboration with interprofessional colleagues to advocate for policy change aimed at reducing health disparity and improve outcome. Quality and policy competencies. Examples of a quality competency are to evaluate the appropriate use of seclusion and restraints in healthcare process. Policy competencies leads opportunity to influence healthcare policy to reduce the impact of a stigma on a service for prevention and treatment of a mental health issue and psychiatric disorder. Independent practice competency include develops age-appropriate treatment plan, include differential diagnosis, assess medical impact on psychiatric treatment, conduct individual and group therapy, apply variety evidence psychiatric therapy, follows recovery-oriented principles, demonstrates family care best practice, plans to minimize complications and promote function, treat acute and chronic psychiatric disorder. Also, independent practice competency include prescribes pharmacology agent safely, ensures client safety with appropriate treatment interventions, explains treatment risk and benefit to client and family, identifies nurse practitioner role in a risk management and substance abuse, seeks consultation when needed, uses self-reflection to evaluate care, provides consultation to improve quality and lowers the cost, guides client on the use of complementary and alternative treatment. To continue the independent practice components, uses individualized outcomes to evaluate psychiatric care, manages psychiatric emergency, appropriately refers clients, facilitate client transition across the care levels, evaluate care usage outcomes, prioritize client nurse practitioner relationship for change, maintains long-term therapeutic relationships, includes client nurse practitioner relationship therapeutically, addresses issue of abuse, substance usage, sexual and spiritual care. Independent practice components applies therapeutic strategy based on theory and research, uses self-efficiency empowerment principles for change, establishes and maintains professional boundaries, educates client, family, and groups, provides psychoeducation, adjusts treatment based on client's readiness, considers motivation for self-care and improvement, understands and documents inclusion and restraint usage. Growth of the nurse practitioner role, facilitating factors for growth. Consumers, like the patient, family, groups, and populations, demanded for service. And also there's acceptance of advanced nurse practitioners. Emergence of the psychiatric nurse practitioner role, decrease stigmatization, and emphasize on an integration of a healthcare system. Last slide, we talked about factors that support psychiatric nurse practitioner growth. This slide, we are going to talk about factors that restrain psychiatric nurse practitioner growth. Increased competition for nurse practitioners are one of the restraint factors. Reimbursement challenges with Medicare and private insurance is the other one. Overlapping scope of practice with other nurse practitioners. Concern over reimbursement, fraud, and abuse. Need for formal, supervisor, or collaborative relationship with psychiatrists. Those are the factors that restrain the growth for psychiatric nurse practitioners field. Regulatory for practice. State status guarantee legal authority for nurse practitioner practice. Include title protection, definition of advanced practice through each state Nurse Practice Act. State law defines the scope of a practice for nurse practitioners by placing a practice restriction and setting credential requirements include education and certification. A nurse practitioner may need collaborative agreement with physician or psychiatrists, overseeing the prescribed medications and provide oversight for nurse practitioner practice. It depends on the state you are practicing or have the license from or certification. Some states require nurse practitioners to practice independently. Some states require nurse practitioners to collaborate with psychiatrists or physicians. So depending on the state, please read the rules and regulations for the state you want to be practiced on. So regulatory practice differ by state, defining the practice scope, requirement, and unique restrictions. License. A process where the state agency guarantees permission to individual to practice a professional and prohibits others from doing so. Accreditations. Process used to protect the public by ensuring a minimum level of professional competency. Certification. Credential provides title protection for professionals like nurse practitioners. Defines the scope of practice. Certifies mastery of essential knowledge and skills. Ensures adherence to specific standards for specialty practice. Scope of practice. Defines nurse practitioner role and actions for variety of competency. Expectations for nurse practitioner vary from state to state. Advanced practice standards for psychiatric nurse practitioner are detailed in Psychiatric Nurse Practitioner Scope and Standards of Practice. You may ask, what is the standards of practice? They are authoritative statements for defining care quality and types. They help assess care nature and set expectations for variety of illness. They establish minimum acceptable performance levels. They serve as a legal standard for providers. They may include specific protocols or general action guidelines. Confidentiality. Client can expect to share information with healthcare providers to remain confidential under the medical record Confidentiality Act of 1995. Confidentiality applies to both verbal and written information. Providers must discuss confidentiality, obtain consent, and address disclosure questions. A signed medical authorization is necessary to release records to clients and other healthcare providers. HIPAA is the first National Comprehensive Privacy Protection Act that ensures 4 key client rights: the right to education about HIPAA privacy, the right to access medical records, the right to request amendment to health information, the right to request permission for personal information disclosure. High tech. What is high tech? High tech is healthcare, information, technology, economy, and clinical health act. It incentivizes payment for sharing specific healthcare data. Meaningful use incentive aimed at improving healthcare outcomes, enhances individual and population health outcomes, improves quality, safety, efficiency, effectiveness, and overall patient outcomes are promoted through the healthcare data sharing. Additionally, benefits include e-prescribing, computerized physician order set, and better care tracking to avoid care duplications. For example, if this patient went to this clinic and they did X-ray, they take a lab, you don't have to redo it everything again. You have to check what they did and what the result was, and then begin the next step. Telehealth. Telehealth for mental health care in a rural area must meet the same standards as inpatient care. It must comply with international, federal, and state regulations. Emergency care professionals should be included also. HIPAA compliant is required for confidential and healthy record maintenance. What are the exceptions to guarantee confidentiality? When confidentiality must be breached. If the need for information outweighs the confidentiality. If the client intends to harm themselves or others. If the information given to lawyers in litigation. If the releasing records to insure companies. If complying with the court order or subpoenas. Meeting with mandatory reporting requirements, like the theory-of principle duty to warn potential victims of immediate danger, increase of a child or elderly abuse. So, for example, theory-of principle duty to warn potential victims of intended danger. There is a story behind that. For example, one of the patients come to you and say they are attended to harm some person, this person. You have to warn that person. You have to save the others and save the patients. You cannot keep quiet and keep the secret for that reason. Informed consent include first educating the patient about the treatment, about the procedure. Do they know what they are getting into? Do they know the treatment? Do they know the procedure? Are they okay with that? Either when you after you educate the patient, answer their question, either they will accept the treatment, accept the procedure, or they will reject because they have to weigh the risk and benefit for the treatment or the procedure. As a provider, you will share relevant information that is crucial for the informed decision making. You have to share that information and say, this treatment, this is the benefit from the treatment, this is the risk for the treatment. This is the obstacles. This is the benefit you're going to get from the treatment. And then they have to make their own decision. Informed, you already informed the patient. They are aware of the risk and benefit for what the treatment or the procedure is about. Then they can accept it or reject it. So you will share that crucial information to make the decision. Then the process acknowledges the rights of a competent adult. Are they in right mind? Can they make this decision? Can they know this procedure is beneficial or risky? If they are not aware of the risk and benefit, if they are not competent adults, they cannot make that decision. What are the competent adults? They have to be emancipated minors. Also, if the patient is under 18, they can be emancipated minors. What does that mean? That means if they are married, have a family, take that responsibility already, if they are parents, if they live independently, if they are legally emancipated, they can make that decision. So they will be considered as a competent adults. That is who can make informed consent. Informed consent. Providers like the nurse practitioners are required to document informed consent in the medical record of the patient. The psychiatric nurse practitioner must ensure the client has the cognitive capability to give consent. The nurse has to explain the nature and the purpose of the treatment and the risk and benefit of the treatment, and then explain the alternative and the risk and benefit of not getting the treatment or the procedure. The alternative also, it has to give options, the alternative treatment and diagnostic and prognosis. You will give options. This is the treatment I have for you. This is the risk. This is the benefit. if you don't take this treatment, this is the outcome. This is what you get. Also, if you don't want this treatment, this is the options. There is other treatment. There is other options. But if you don't take any of them, this is the risk you can face to your health, to your mind. This is educate the patient so they can make consent, informed consent, either to choose the treatment or to reject the treatment. Ethics. Nurse practitioner role involves moral duty, obligations, responsibility. Ethical principle guide complex decisions. The core of ethics for nurses consists of 9 professions emphasizing compassion, respect for individual dignity. Nurses' primary commitment is to advocate for the client rights, health care, and safety. Nurses have the authority and responsibility for their practice and decision-making to promote healthy and provide optimal care. Ethics. Nurses promote health, safety, and maintain professional integrity. They work toward personal and professional growth. They foster ethical work environment. Nurses advance profession through research, improve standards, and health care policy development. They collaborate with other healthcare professionals and the public. It's essential to protect human rights and promote health equality. The nursing professional emphasize clear communication of its value and incorporate social justice principles into healthcare policies. Ethical principle in psychiatry. The key ethical principles in psychiatry are clients should fully participate in the decision making. Clients have a right to treatment in the least restrictive environment. Client can refuse the treatment unless mandated by the court. Ethical dilemma is when there is an alternative exit in ethical decision making. So there is different choices to make. You can make this decision, it could be ethical. You can make other decision, it could be ethical. So which one do you choose? You choose the one that reduces the harm and improve the quality. There is a hierarchical approach to ethical decision making. One is based on charge, based on the act itself, regardless of the consequence. There is another one, charge based on the consequence or the outcome. Value ethics based on moral virtue and characteristic of the decision maker. So it depends on. So what do you do if you have to look for help, you have to talk to if you work hospital, you will talk to ethical committee, you research the topic, you talk to the family, you don't make this kind of decision quickly because it depends on other people's lives or other people's decision. So Talk to the other ethical decision-making professionals. Ethics of a disclosure by the providers. What does that mean? Ethical disclosure is a core obligation in healthcare. Providers are ethically required to communicate honestly, transparently, completely with the patient, especially when information affects decision making or the truth. Clients have a right to be informed about their treatment. Providers are ethically obligated to disclose error, accident, neglect outcomes. Disclosure may entitle client to compensation for harm caused by the medical misshape or error. What are the disclosure risks? Employers may hesitate to hire individuals with disability. If you say you are disabled, many companies will not hire you. Discrimination can occur against the co-worker with mental illness. There is a people, if you told them, oh, this person has a mental illness, or they know if the co-worker has a mental illness, they may discriminate that person. There are assumptions about lower productive affecting a career advances. Your boss might not advance your career if he knows you have a disability or mental illness. Employees may not get constructive feedback due to their illness, being blamed for behavior. Labeling as a disabled can negatively affect self-belief and self-image. That means disabled. If somebody label you, or if you have that label disabled, that means something wrong with you. So that labeling disabled, labeling someone disabled, that can affect the person image, can affect his self-belief that they cannot do the job, some jobs. It can lower their self-esteem. Many jobs may not hire. So those are the risks of disclosure. Let us look at the benefit of a disclosure. What are the benefits? Benefits is ability to require reasonable accommodation. Opportunity to have a job coach come to work site and communicate directly with the employer. Employee can involve a employee service provider, employee assistance program, or either third body in the development of accommodation, either for employee to come to work during excess of the symptoms, may help you with the recovery process, allows co-workers to offer personal support, may employer either or employee to disclose. So sometimes it's good that your co-worker or the job or the boss knows the disability you have, so you can get help. It's hard for you to perform this job. It's better to have the disclosure of your disability, because it will be hard for you to hide, hard for you to perform the job. You don't want to risk yourself or others. So that is the benefit of that. What are the legal considerations a nurse practitioner has to consider? Malpractice insurance provides financial protection against malpractice claims, and it covers negligent acts. It is essential for healthcare professionals, including nurse practitioners. Does not protect against the charges of practicing outside of your legal scope. We talked about the legal scope. So if you are practicing outside of your legal scope and you are doing something you shouldn't be doing, that is not in your scope of practice, the malpractice insurance will not cover that. Legal considerations. Nurse practitioners should receive their own legal representations to advise them for even if their agency has malpractice insurance. To provide malpractice insurance, four elements of a negligence must be established. What are the four? Duty. The nurse practitioner had a duty to provide a reasonable care. She has that duty. The nurse practitioner breach of a duty. The nurse practitioner did not meet the standard of her care. That means she breached the duty she had for the patient. Proximal causes. There is a link between the breach and the client injury. Is there a link between nurse practitioner did not meet the standard of the care and the client injury? Damage. The client suffered significant damage due to the breach or the neglect. Those are the four elements of the malpractice. Competency is the ability to make decisions. It is a legal, not medical concept. A determination that the client can make reasonable judgment and decision regarding treatment and other healthy concerns. A person is considered competent until a court rules the person's ability to be incompetent. If a person is deemed incompetent, a court-appointed guardian will make health-related decisions for that person. So if the patient cannot make that decision, court has to appoint other person who will be the guardian who make the decision for the patient. So if you are a nurse practitioner, you will talk to that person. Commitment. Commitment involves involuntary evaluation or treatment procedures differ from state to state. Requires a psychiatric diagnosis disorder. Individual must be harmed to themselves or to others, must be unaware or unwilling to accept their disorder. Potential benefits from treatment are necessary. So involuntary admission involves admission to the hospital or other facilities. Client keep most of a civil liberty except for freedom of movement. During of the confinement variety by state. So how long you can be held in the hospital, how long you can held in maybe jail or prison. jail, I believe. It's different from state to state. Voluntary admission is when the patient is agreed to the admission, agreed to the hold. Client maintain all civil liberties. Client consented to the potential confinement in the hospital. So some clients, they can be held 72 hours hold. They can be held more than that, depending on the risk they are facing when they go outside the hospital, or if they are willing to take their medication, treatment. Some psychiatric patients may not take their medication and they become psychotic, and they are harming to their family, their friends, the public, and then somebody will call the hospital, police, somebody will call and say this person is acting weird or acting risk, and then there is a 72 hold, then you will go to the court and then you will get order to hold this person. There is a process to go through holding this person for not harming themselves or the others. So commitment, that is what it means, commitment to hold this person until they can better, until they agree to take their medication, until the situation changes safely. Scholarly activities. It is important for nurse practitioners to engage in the following scholarly activities. They should publish like the video, like articles, like books. They should lecture and do presentation. They should precept other students and continue education. That is why I began YouTube channel. It will help me to achieve all this. I want to help the other students. I want to improve my education. I want to lecture others for treatment and procedures. I want to do presentation in here. I want to publish videos, and future, hopefully, I can publish books, articles, and I want to improve my education and education of others. That's why I began the YouTube channel. Thank you for being here. Mentoring, a process in which more experienced nurse practitioner agrees to guide and support junior colleagues in the role, competency, and skills require a mutual respect and interactive process of learning. Needs involvement by both mentor and mentoree in the relationship. Client advocacies, standing up for client rights and empower them to become their own advocacies. Reduce the stigma of a mental illness. Help a client receive available service. Promote mental health by participating in one or more of these professional organizations. Nurse practitioner can participate in American Nurses Association, American Psychiatric Nurses Association, International Social of Psychiatric Nurses. You can participate one of these organizations to advocate for patient rights and empowerment and service. Healthy policy. Nurse practitioners are not just physicians. They are advocates, leaders, participants in shaping the healthcare system. Advanced nurse practitioners have a legal and ethical duty to advocate for the patients. They should participate in healthcare policy activities at various levels, like a local, state, national, and international. Activities may include testifying, lobbying, and raising medical awareness. The policy-making process consists of formation, implementation, and evaluation. That's what I'm doing here. Risk assessment and risk management, a system of a control oversight, service and benefit provided to the client, consisting of a coordinating care, ensuring quality outcome, and promote plan of care and doing advocacy. Overall goal is to promote quality care and cost-effective outcome. Continue monitoring for high-risk situation, assessing person for non-healthy behavior. Activity and the system is designed to recognize and intervene to reduce the risk of an injury to the clients. Appropriate intervention is implemented to reduce non-healthy behavior in a client's and high-risk situations. Recognized and interventions to reduce subsequent claims against healthcare providers. Advanced directives. Advanced directives is a dual power of attorney for healthcare. Also, they call healthcare proxy. It's a legal binding in all 50 states. Designated an agency for healthcare decision making when person is unable to make decisions. Covers range of illness, not just the terminal ones. So the patient will have advanced directives. When they are healthy, they will sign a form that will designate somebody that will talk on behalf of them and say, if I cannot speak on myself, I want you to speak on my behalf. So that is called healthy proxy. So if the patient is incapacitated or cannot speak themselves, they will speak on the behalf of the patients. It's important to have advanced directives for relapse planning in a client with chronic psychiatric disorders like schizophrenia. Schizophrenia patients, they lose reality. They hallucinate, they have a delusional, they cannot make the judgment. So for example, that patient is good to have advanced directives. There is also living will that expresses care preference while a client are mentally competent but may not legally binding in all states. Culturally competency care, what does that mean? It's the one of the competency for the nurse practitioner to have. But what does that mean? It means treat client from diverse cultural as a unique individual. So if everybody is different, recognize how cultural experience may relate to symptoms and perceptions. Provide comprehensive health care by being sensitive to the cultural issues. Understand that culture include beliefs, behavior across various groups such as racial, social, ethical, and religion. Be aware of cultural bond syndrome to avoid misinterpretation. Cultural beliefs as a psychiatric disorder. Strange. Determinants of health. Determinants of health is factors that affect the person's health. So how culture influences determinants of health? Okay, family is a group of related adults and children responsible for providing essential needs like the food, shelter, clothes, safety, education, while providing teaching, social beliefs, cultures, and norms. So, if you have limited food or if you don't eat nutritious food, that can affect your health. If you are homeless and you don't have a shelter or clothes or safety or education, that can affect you, can affect your longevity, can affect your health. So depending on the family you come from or your family you have, they can affect your health and well-being because shelter, your house or your neighbor can affect your health. Where you live can affect your safety, education, clothes you wear, food you get. Also your family, if they cannot provide you all this essential life is when you are younger, that can affect you. Okay, ethnicity. Ethnicity is the self-identified race, tribe, or nation influence beliefs or behavior. Community, a group of families share a similar culture or racial background. Not always. If you have a community in your neighbor, let's say you live one of the cities and you have a community. Community can be your neighbor. They don't have to be similar, share similar cultures or background, but they share the location with you. They share the need with you. You have a common grounds that you want to accomplish together. Okay, environment. Environment encompasses physical and psychological factors impacting an individual life, include social contacts, housing, climate, pollution, and issues like homelessness, crime, and poverty. Yes, if you live environment that is low housing environment, crime, pollution, homeless, that can affect your health or your life. It can affect how you live. It can affect what you breathe. It can affect what you eat. It can affect your safety. It can affect your education. It can affect your life and health. Homelessness. Homelessness is a major issue impacting emotional and physical health in the US and around the world. Challenges for homeless individuals include substance abuse, violence, behavior problems. Nurse practitioners must have effective communication skills and resources acknowledged to support this population. Homeless person lacks stable night housing, may leave shelter, hotels, or unsuitable places. The homeless population include men, women, children, families, especially single mother houses. Female head of household face incredible vulnerable without education, job skills, or access to affordable housing. Teen mothers are at high risk due to similar challenges. Homelessness. There is many reasons for homelessness. Mental illness. Person may have a mental illness disorder. They may have addiction disorder. They are unemployed. Poverty. That unemployment leads to poverty. They cannot get enough public assistance, and then they face domestic violence and lifestyle choices that make them homeless or go through homelessness. Mental illness and addiction disorders in the homeless population are around 50% and have co-occurring substance usage disorder. And they have a serious illness like the bipolar disorder, schizophrenia, and depression. Schizophrenia affects 15 to 45% of the US homeless population. Symptoms are often untreated, and that leads to issues like paranoia, hallucination, and depression. These with schizophrenia disorder face higher risk of a violent, non-compliant with medication. They are non-compliant with medication and treatments, or they refuse because they are paranoid. They don't want it. They don't believe this medication is helping them. They have hallucination and paranoia and depression, and they are not mentally stable, and they are homeless. All this affected their lives. And what are the strategies for reducing homelessness? Outreach will be one of them. Introduce service to the homeless individual with serious mental illness and build empathy relationship for treatment. If they don't trust you, they are not going to accept the treatment you are providing them. So you have to outreach, you have to introduce yourself, you have to have that empathy relationship with them. And then integrated care. Combine mental health and medical care, including dental, pharmacy service for improving community function. Because when the homeless patient come to you, or when the homeless person come to you, you may never see them again. They will come one time and they will disappear. They don't have address, they don't have emails, they don't have phones. So how are you going to help them? You help them that time. You do what you can do that time to improve their lives and their health. Okay, collocation. Provide mental health and primary at the same time. same time and same location. Yes. Supportive for housing. Help a homeless individual with serious mental illness transition to independent housing with ongoing supervision. So you have to connect them with social workers, connect them resources when they come to you so they can support them. Prevention. Initiate discharge planning in inpatient setting, offering resources for mental health care, housing, and follow-up appointments. I have seen patients who come to the hospital and they are homeless, they don't have where to go, and then some of them they may not accept it. Social worker will look for housing, will look group homes, and then they may not stay there. That's where they discharge it to from hospital to outside facility like group homes or community centers, but they may not stay there and they may go and they may not take the medication or the treatment, and then they will come back to the hospital again, either for call hold or somebody will call and they will come back. And then when you ask them what happened, they will say they didn't take their medication. And then the circle continues. So it's not something good, it's bad. Migrants and seasonal farm workers. Migrants often leave permanent houses for seasonal agricultural jobs. Yes, if you cannot get job in the city or permanent where you have the permanent houses, you can't stay there if you don't have a job or income. You have to go and find a job wherever you can find it. You are immigrant, you have a lot of barriers. The language is one of them, skills is one of them, unfamiliar environment will be one of them. So you have to go wherever and whoever hire you. And you will live wherever you can live. You could be homeless, you could have a non-good environment is like poor housing or under the tree or under the sun, wherever takes to live or survive, you and your family. That's how you're going to get jobs. Over 3 million migrants and seasonal workers are in the US, but the accounts are hard because seasonal and immigrants, they move around. They move wherever they can get jobs or opportunity. Workers face tough conditions, include high rate of mental illness, depression, anxiety, and substance abuse. When you are living in hard condition, when you are struggling in life, it will you will come across, it will affect your life. You will get depressed, you will get anxiety. It's tough life. So that is what they going through, many of the migrants and seasonal workers. Women are particularly vulnerable to physical and emotional abuse. Okay, addressing mental health care needs addressing the mental health care needs require empathy and cultural sensitivity. When you are nurse practitioner, when you are doctor, don't assume what the patient is going through. Don't assume they live your life. You don't have their life. You don't have their experience. You don't know what they're going through. You don't know where they slept the last night. You don't know what they are going through their life is. So don't assume. Just listen and involve them with the care. If you want to provide better care, especially mental health cares, listen, involve with them. Let them tell you what they would like and how they would like their care to be done. Connect with them person and person level. That is how you're going to have an empathy relationship with them. Doesn't matter the culture they come from. It is person to person. They can relate to you. They can feel you are there for them and wishing their best. So empathy, care, and patient-centered care. Those are the ones. Forensics and corrections. Deinstitutionalization in the 1970s left many individuals with mental illness and intellectual disability without community housing. These individuals are overrepresented in the criminal justice and with higher rates of serious mental illness among prisoners. Common conditions among inmates include PTSD, major depression, and bipolar disorder. In a Texas study, 15% to 24% of the inmates reported psychiatric disorder symptoms. 43% to 54% show signs of manic. 23% to 30% experience major depression. Lack of coordinated care among criminal justice, mental health, public health systems contributes the repeat incarceration. So nurse practitioners must maintain neutral objectives in care and debriefing. Forensic science applies scientific knowledge to legal issues, intersection healthy and legal system through patient service and expert testimony on trauma. Forensic knowledge base. Forensic is a nurse-client relationship based on criminal committed and investigational aspect of the interaction. Correctional nurse-client relationship based on an offender current mental health and medical condition. Location: emergency department, prison, high, middle, or low security units. That's where the nurse practitioner who are forensic have that knowledge work. They work on the court system or police stations. That's where the patient will be. That's where the nurse practitioner who are specializing forensic will work. They use evidence-based practice and the best clinical experience. That's what they use to do their job. They integrate criminal justice with mental health systems. It requires a knowledge of a court function, litigation, procedures, and relevant case law. It also requires understanding mental health issues, distorted thinking, and impaired judgment. Forensic risk assessment. Forensic risk assessment ensures competency in risk management, aggression control, therapeutic relationship, prison culture, documentation, medical knowledge, psychopharmacology, and crisis de-escalation skills. So you need to have risk management skill, aggression control, you have to know that, and you have to have that skills. You have to have it. You have to have a knowledge and have that therapeutic relationship with the patient or with the person. You have to be familiar with prison culture. You have to document details. You have to have a knowledge, medical knowledge. You have to have deep psychopharmacology knowledge. You have to have skills for crisis de-escalation. Okay. Forensic risk assessment. Forensic risk assessment protects the public from persons with known mental disorder having a dangerous and violent and criminal history. That's what they protect from the public, and that's what they care for. Risk assessment. You need psychiatric evaluation performed in the emergency department after arrest and before person is confirmed to control facility. So you do the risk assessment when the person come to the emergency after they get arrested and brought to the emergency department, and before they been confined to locked unit, because you want to know how to treat the patient, how the other staff will be safe around, what the patient need. You will assist the medical and mental and risk. So you will assist all that.